Back now to the H1N1 discussion. The CDC making public comments on the virus this season. The government is releasing $1.5 billion to help states with their vaccination programs. That as a report from 5 countries in the southern hemisphere show that the virus has not changed much, hasn't mutated from what we saw in the U.S. earlier this spring. For more perspective on the medical aspect of H1N1, we're bringing in Dr. David Dobby, an infectious disease specialist at Spectrum. Doctor, thanks for your time tonight. It hasn't mutated. I guess that's good news, the silver lining in this so far.
It seems to be pretty much exactly what we experienced earlier and what they had in the southern hemisphere. And the other part of that is it still remains susceptible to the usual anti-influenza viral medications.
So what we have to combat it, we'll fight it to an extent, and we're satisfied when the vaccine comes in.
It's going to be when the vaccine becomes available, it would be expected to be a good match, which then gives us a good opportunity for the vaccine to be helpful in preventing severe disease and hopefully preventing infection at all in many people.
The CDC in their guidelines, and we saw a little bit of the soundbite earlier in the broadcast, seem to be saying if you think you've got it, stay home, ride it out, don't bother going to the doctor's office unless it takes a turn for the worse. Is that advice that you're giving out as well?
I think that if you're not severely ill, if you don't have shortness of breath, chest pain, if you're not very ill, then it's best probably not to come into the hospital, not to come into your doctor's office, because if you don't have influenza, you may get it from someone in the waiting room. If you do have influenza, we would really prefer you don't spread it to others. Not everyone who has influenza needs to be on antiviral medications, and also not everyone with influenza needs to be tested to see if they have it, because the rapidly available tests really can't prove you don't have it. It may show that you have a type of influenza, but it doesn't absolutely prove that you do have the H1N1 virus.
It wouldn't be absolutely conclusive.
No.
So it wouldn't satisfy. If you were curious if you had it, it's probably not a good idea. Just stay home and ride it out.
If there really is a bad epidemic and you're ill with symptoms that fit with that, then you very likely have that infection.
We're starting to see some cases already popping up. Wake Forest, Purdue, these college campuses are already reporting some cases. Their students are coming down with this stuff. That doesn't surprise you, does it?
Well, I think that it's going to be interesting to see how widespread that becomes now that there's schools and, of course, colleges first become back into session. There have been a few sporadic cases over the summer, even in Grand Rapids.
Right.
But if we see that there's a lot of transmission and it becomes an epidemic early this fall, we would not be able to give people influenza immunizations that are effective or match that particular virus. How widespread that will become in all those universities is not clear at this point. They're mainly going to be focusing on controlling it through hand washing, alcohol degermers, distancing, what's called social distancing, which means people that are ill should stay away from people that are healthy.
Wash your hands, huh?
Yes.
All right. Dr. David Dobby, we appreciate your time, an infectious disease specialist at Spectrum. And coming up in a few minutes, we're going to go back live down to the newsroom. We're talking with, speaking of colleges, the Hope College Dean of Students with what his campus is doing to prepare for this season after they had a big outbreak at Hope earlier this year. Swine flu gaining prominence in the headlines now as we've seen several outbreaks at college campuses across the country. You may recall earlier this year, Holland's Hope College doing battle with the potentially deadly disease. Let's get an idea for what they're doing to prepare for this semester, and let's turn it over now to my colleague Sue Shaw, who is live in the newsroom with more. Sue?
That's right, Brian. We brought you continuing breaking news earlier this year when the swine flu hit the Hope College campus. Today, we're in the newsroom. We're talking with the man who was in the thick of it all, Richard Frost, Dean of Students at Hope College. So you have a little experience with this because in November, it was the norovirus, and then we had the swine flu.
Right. We've had both, so we know kind of what we're doing. I think we're prepared. I think we've worked with Ottawa County Public Health, our health clinic, and we have all the protocols, and the first part is always education.
Sure. And now, you had to close down the campus, though.
We closed in Noro.
Right.
We did not close
Back in November.
H1N1. Right, and so we had to kind of keep it open and work with public health to make sure we were following all their protocols.
Okay. The big question at this point is, what are you doing? Are you doing the same type of thing that you did in these other two cases? Have you changed anything from what you've learned out of those two scenarios?
I think what we've learned is you don't wait.
Right.
And you get an early start, and so we're meeting with students, student groups. We are mobilizing and getting a lot of hand sanitizers around the campus, so we have a much better reporting system of students who may feel like they're ill and getting back to them. And so we've taken a lot more precautions, getting the seasonal flu vaccines into those students, so we're kind of testing our inoculation procedures. So we're doing a lot of different things to prepare for what's going to happen.
Okay, so right now it sounds like education.
Correct.
Getting the communication sort of systems in place.
Right, getting the community ready.
Okay. Tell me a little bit about how you're going to be able to keep tabs on the students that are sick, and how are you going to know when you need to do something more?
I think the whole thing is that we are a Sentinel site. And so as a Sentinel site, we do work with the Ottawa County Public Health, and they in turn work with the state. And so we are going to be reporting, and so they, along with my team that works at the college, will keep track of students and the number of cases. And as we see cases increase or decrease, we'll move differently. And so if it's more concentrated in a certain building, we're going to go there. And so we're going to try to isolate, social distance as much as we can, so that students stay healthy, that are healthy. Right. Those that are sick, will keep them more isolated.
And the hand washing. And,
all the time.
And the alcohol. That's
all the
right.
time.
Tell me a little bit, when you guys had to shut down, what goes into getting the campus ready to allow students back in?
I mean, the big thing is that our custodial and cleaning services did a great job, as well as food services. You just have to go through and clean every surface that you can, and then students have to do their part. You know, because if you think of their rooms, I mean, they have those rooms that are filled with everything. They've got to go and do their part in terms of sanitizing and doing their part in terms of sanitizing. So once we get the public areas and the semi-private areas ready, then we can let the students come in and do their areas. And so it's a monumental task to kind of get the whole campus sanitized top to bottom.
And on the same page with this whole thing.
Correct.
Yeah.
Absolutely.
Okay. Richard Ross, thank you so much for joining us. We appreciate it, from Hope College. Back to you.